Hey, good morning and welcome to UroNurse, your go-to place for urology nursing education, all education in urology. Hey, if you're watching us live, great. Glad to have you on board the show for today. Going to be an interesting show. And be sure to hit that subscribe button and the like button. Hey, if this is your first time here checking us out, be sure to go to our website at uronurse.com. Best place to learn more about the show. Also, the best place to see all of our past episodes. 107 of those. Yes, we already rolled over our 2-year mark. Want to listen to us in your car? Go ahead. Check out our UroNurse Plus area. It'll take you to our audio podcast where you can listen to us on any of your favorite podcasting platforms. This week, we're going to be taking on a little controversial subject. Cranberries, do they really help for urinary tract infections? Is it myth or is it medicine? We'll decide. So with that, let's go ahead and bring in our group of experts. Experts, welcome to the show. Hey, how's everyone doing today?
Good.
All right. So ready for this really strong discussion on cranberries?
Yes.
I'll let Andrea kick it off with your introduction and let everybody know who you are, just in case you're new to the show.
Great. Well, my name's Andrea Strong. I am a nurse practitioner. I work in an academic setting. I started my urology career back in 2009, actually, and I started as a nursing aide on an inpatient urology floor. I've done just about everything that there is to do in urology. I worked as a nurse. I've done day shift. I've done night shift. I've done inpatient. I've done outpatient. I've done all the procedures just about and seen all of the patient populations. I also have several leadership positions with the Society of Urologic Nurses and Associates, and I am a registered urology nurse. And I do see recurrent urinary tract infection patients in my clinic all the time. So I'm really excited to talk about cranberry tablets today.
All right. And Lori, go ahead and introduce yourself.
Good morning, everyone. My name is Lori Atkinson. I'm a certified urology registered nurse. I have been in urology since 1998, which is a very long time. And I work for a really large urology practice in Geneva and Winfield, Illinois. Happy to be here.
All right. And of course, I'm Vic Sinise, the host of the show and producer. I couldn't do this without my special experts here, so I was really glad that they were willing to join me today for this discussion. It's going to be a little different format. We're going to actually kind of make it open to discussion. You guys can put the comments through on the comment box if you have any thoughts or opinions on cranberries. Do you use them in your practice? Do you not? What do you think? Is this just all a bunch of hooey balooey? Anyway, it's going to be interesting. We're going to do our presentations. And again, we're going to have it kind of set up as a little different with it's going to be a discussion group. So if we interrupt each other, don't feel bad. I already gave everyone permission to interrupt me. So I'm going to kick off the talk. So I'm going to go ahead and bring my slides in here. All righty. Hey, it's always great when it works. So I'm going to kick everything off with cranberry juice for UTI prevention, evidence and insights. And this was I got the inspiration to do this because I get these, I don't know if you guys are signed up for these studies that come in, but there's a group of them that will show you the latest studies. I should probably do a presentation on that. It's kind of cool because I get an email almost every day of something of what's going on. Now, a lot of it has nothing to do with urology, but this one came across my desk. Cranberries confirmed as a natural remedy for UTIs. Out of Bond University. If you're not familiar with Bond University, it's in Australia. And that's where they did this study. And so I said, hey, this is really kind of a great subject to talk about. And we've got a group of experts that can lend an opinion to it. And I'm always in to do a little research. So anyway, here's what I found from their study. It was conducted by Christian Morrow, PhD in biomed out of Australia. It was a systemic review and network meta-analysis. Had 20 trials, and they fairly, I think, a reasonable amount of people, 3,091 children and adults at risk for UTIs. So this is their conclusion from this. They found that using it, cranberry juice, that you could get a 59% lower risk for UTI versus no treatment, and a 49% versus a liquid placebo. So they better than 50% or at least 50% difference in the risk for finding somebody with a urinary tract infection. That's where they base their certainty on. Now, of course, they did some analysis, and the certainty level only was moderate to low based on this study. So their recommendation and their conclusion was cranberry juice is effective in reducing UTIs and should be considered for UTI management and prevention, based again on this European urology focused study that they did. Now, I don't know about you guys, but I was at a meeting once at a SUNA meeting, and somebody said that the chemical that is in blueberry or in cranberries, it's called this. I can't even say it, but it's the PACs. They're actually
Hey,
in higher.
Vic,
Yeah.
sorry to interrupt, but I was having a hard time pronouncing it as well. So I spelled it out
Don't apologize.
phonetically here.
Cyanidine.
Yes.
Hey, we got somebody who can say it. So I'm going to just call them PACs.
Cyanidines,
Yeah.
PACs or PACs.
So they're Pac-Man to me. So the Pac-Mans inside these cranberries, I was told at a meeting that blueberries are actually better. Anybody ever hear that?
No.
I was at this meeting, and of course, I've been around for a long time. I can't even tell you how long ago it was I heard this, but they were saying that the amount of packs in blueberries, you could take 1 cup of blueberries and it would be equivalent to like drinking a gallon of cranberry juice. All right. So I said, well, as long as I'm talking about it, maybe I should look into this. So I did and looked into whether, there was a difference. And there's that big fancy word, by the way, proanthocyanid PACs. And the reason that they believe that this is helpful in UTIs is that PAC prevents E. coli from sticking to the urinary tract walls. So the bladder walls don't let the bacteria, even though there may be bacteria, this is definitely not something that's going to kill bacteria, but it'll keep it from sticking. You'll just flush it out of your system. Of course, drinking that gallon of anything probably helps too, right? Strongly supported by research for reducing UTI recurrence. Okay. And available in multiple forms, juice, tablets, and capsules. And Andrea's going to talk about the capsule form. But blueberries in their own prevention for UTIs. And by the way, I love blueberries. I'll eat all the blueberries in the world. I'm not a big fan of cranberry juice. I'll drink it, but I'm not a big fan of it. But I live in Indiana, and Indiana is one of the big producers of blueberries. And actually, every year we go blueberry picking for our 1-year supply. We freeze them. I mean, the blueberry is a great fruit because you can freeze it. It's just the same as it is once you defrost it is when you pick it. So we pick a year's worth of blueberries. Last year, I had my grandkids, and I've got 6 of them from Florida that happened to be in. And I'm like, boy, you can't get cheaper labor than that. Give them a cookie and they'll go out and do some work for you. So I took them all blueberry picking, and they picked like 24 pounds of blueberries in no time flat. So filled up my freezer. But anyways, the big thing about blueberries, they say it also contains PACs, but it's in a different form than cranberries. I wonder if that's has anything to do with this. Less research for UTI prevention. I can find very little, like looking just through the Google search. But they can be consumed fresh, frozen, or in juice form. So now comparison, cranberries seem to be more effective for preventing UTIs. Blueberries are good for general urinary health, and they taste good, but less potent for UTIs. So the conclusion was cranberries are beating out blueberries. Now, we still haven't decided whether cranberries are myth or medicine, but we'll get to that. Again, I mentioned these PACs. So there's other foods that contain PACs, and cranberries just one of them. Blueberries, I mentioned. Grapes and red wine. Now, there's a treatment I can take. Apples, chocolate, dark chocolate especially. The benefit of dark chocolate, huh? And pine bark. Well, I don't think I've ever had pine bark. But I did get a little chart here that I put up that has the PAC content, and we can see that blueberries 179, 331. I don't know. I'm embarrassed living in Indiana. I don't know the difference between the cultivated high bush and the low bush, but all I know is they grow in a bush. versus the Cranberry, which is 418. So it's truly, there's more PACs, and they say better PACs in Cranberries. Now, other thing is something called chokeberries. Anybody familiar with chokeberries?
No.
Lori, Andrea, never heard of it. I never did either, but it's
No.
loaded with PACs. Of course, I'd be, prone to look and see what it is. So I did. And this is what a black chokeberry looks like. Looks kind of like a blueberry to me. But they said that it's not very good to eat. So you have to kind of put it in syrups and things. So, if the sugar doesn't kill you, then I don't know whether it's going to work for your UTIs or not. But anyway, not as effective. All these treatments should not replace medical therapy. Important that when you're using things with high cranberry content, to make sure they have low sugar. We don't want to be sugaring everybody up. And part of a broader strategy, including hydration and hygiene. So I'm going to bring it over here to the panel. What do you think? Myth or medicine? Where are we at right now with what I presented?
I'm going to say medicine.
I don't.
Okay. Lori, what's your thought?
I don't think it's a myth. I do think it's medicine. However, I think that you need to combine it with other types of treatments, such as adding the water with it, and other things, such as the vitamin C or the D-mannose or the probiotics. There's other things that in combination with it will help even better, in my opinion.
Absolutely.
And how about you listeners out there? Any opinions? Go ahead, put those through. Lori, if you see anybody putting some opinions in from the comment section, throw them up on the screen for us. But I'm on the fence still. I'm not, I've been involved in urology for 40 years and have had multiple patients come in and tell me that, yep, they control their urinary tract infection by drinking more cranberry juice. So they're convinced. So there's probably some decent science out there that says there's something into it that does prevent adherence to the bladder wall. They do say that that's mostly effective against E. coli too. So it's not like, even though that's the most common urinary tract infection, it's not the only urinary tract infection. So that's one of the things to keep in mind.
That's correct.
So I have a question for you guys. I have a question to bring up.
Sure.
A lot of times, we obviously we tell people to drink cranberry, do cranberry extract or what have you. Do you tell people to avoid it when they actually have symptoms of a UTI? Because it can be irritating to the bladder.
I don't ask my patients to avoid it.
But I was just curious because, it tends to be an irritant as well.
Right.
And I think that if you have symptoms that they may need to lay off. I was just curious because I've heard that before.
Yeah. Yeah, that's a good point, Lori. I don't ask my patients to avoid it. I haven't found that cranberry juice is, even though it is listed as a bladder irritant, I've never had a patient tell me, oh, it's the cranberry juice that really makes my bladder act up per se. Now, if it's a sparkling cranberry juice, then that added component of the carbonation could definitely irritate the bladder. But I don't tell patients to avoid cranberry juice or cranberry products while they have a urinary tract infection. In fact, some of the cranberry products ask patients to increase their dose during times when they feel that they're getting a urinary tract infection. I've had some patients tell me, oh yeah, I followed the directions on the bottle of my cranberry tablet. It says when I'm starting to get symptoms of a UTI, then I need to increase my dose to X number of milligrams. It depends on the product. It kind of varies. And they're claiming that they can get rid of a urinary tract infection with cranberry and hydration.
Yeah, that's what I've seen too, is that if you start having symptoms of a UTI that if you're not doing it, start it, because it can lessen the strength of the UTI per se, try to minimize it and then hopefully flush it out with like water.
Yeah. I think it's important to select the right patient for this type of treatment. If somebody is young and healthy, they're not pregnant, they're not trying to get pregnant, they don't have immune suppression, then it might be a good option. But if your patient's already had a renal transplant, which increases their risk significantly because they're immunosuppressed from the medicines that we have to give them to lower their immune system to prevent the body from attacking the new organ. And if they get a UTI and it gets into the kidney, it can cause kidney damage or rejection of that new kidney. So you might be a little more selective in those patients. And maybe you want to do something more, get infectious disease involved, and perhaps do something like a daily low dose antibiotic for those patients, which I've seen. But those daily low dose antibiotics also come with their own set of risks. It is listed in the guidelines as a treatment option, but you need to counsel the patient that it will lead to drug resistance. One way that I describe it to patients in layman's terms is that once we give you this daily low dose antibiotic, we're going to create a superbug. The bacteria that's in your body will get smart, and then we can't use that antibiotic anymore for a certain amount of time.
Yeah.
So I think
Yeah, I
all in all,
remember, I remember,
Go ahead.
20 years ago or so, we used to load everybody up with daily antibiotics. Oh, you get frequent UTIs, and now we rarely put people on daily antibiotics anymore to prevent UTI. It's all these other methods that seem to help. So,
yeah,
and it
now
kind of avoids even the big studies that have come up with, especially for females and UTIs, with the estrogen deprivation as they go into menopause. They have lower estrogen, and the estrogens can help to change the pH so that it's less likely to get a urinary tract infection.
Exactly. That's even a tool. Using vaginal estrogen is even a tool in perimenopause. So I do use that sometimes in a perimenopause patient as well.
So we were talking a little before the show started, and one of the things that Andrea and I were both kind of talking about is all these things are tools in your toolbox, and you've got a toolbox full. So don't pick one tool. Sometimes you can't always, pigeonhole everything into the one same treatment.
Exactly. Usually, some of those first line therapy discussions that you're having, make sure that you're hydrated, 60 ounces of water a day. And if someone has a really hard time drinking water, they don't like drinking water, they can't remember to drink water, this is a tip that I give to patients. If you have one glass of water, just 8 ounces, every hour on the hour during banker's hours, you will get there. And a lot of my patients are retired. So I tell them that's your job. One glass of water every hour on the hour during banking hours, and you'll get there.
Yep.
Also, don't hold your pee too long. I see it all the time. People get urinary tract infections. I don't have any studies proving this, but anecdotally in my practice, someone will travel and they're holding their urine longer than normal because they're on a plane, they're sitting in the middle seat, they're at the airport, they can't find water, or it costs $10 for a bottle of water. And we tend to get these UTIs when we're traveling. And maybe it's from holding urine too long. Maybe it's from a change in the microbiome. There's new research showing that the bladder actually has its own microbiome, and maybe we're upsetting that when we're traveling because we're changing our sleep patterns, we're changing our eating patterns, we're doing all those things that can disrupt it. But certainly not holding your pee too long is really important as well.
I also read somewhere that you especially speaking of trips, that a lot of people in public restrooms and so forth, they hover. And if they say don't hover, because if you hover, you tend not to empty your bladder all the way.
That's a really great point, Lori.
It makes you, yeah.
Yeah, that's actually, that makes sense, because when you're hovering, you need to use your core muscles. Your pelvic floor muscles are one of your core muscles. So if they're halfway tightened, you can't empty all the way. And you could even reduce the strength. When we pee, the urine actually swirls around just like it's going down a drain. It picks up speed and it helps eliminate that bacteria. But I suppose in theory, if your sphincter is still tight and it's not a very strong stream, you could be altering that natural mechanism to prevent UTIs.
Yeah. April had
Here's
a good idea here.
uh-huh.
She said, I tell patients to drink during television commercials.
Wow, you
Good
get plenty of
idea.
fluid that way. Now, what if you
Except for
subscribe
those,
to us
that
to to
I know,
to like I subscribe to the commercial-free version.
I was just gonna say that.
Yeah, they're gonna throw a wrench into your hovers thing. My wife and I traveled to Italy a while back, and the first time we were traveling by bus, and we had a pit stop, and the women are all coming out of the bathroom with this like horrendous look on their face. I'm like, "What's wrong?" They go, "There's no toilet seats on any of the toilets."
Mm.
And I go, "Well, I mean, the men had both urinals and toilets. We had toilet seats on ours." She goes, "No,
Really?
in Italy, all women hover to use the toilet.
That's
Wow.
interesting.
So it depends on where you live."
Huh.
One thing I did want
Mhm.
to mention, because I know people that this is not just going out to healthcare workers. We have other people that are going to watch this and may be interested in learning more. When we're talking about using something like cranberry juice for UTI prevention, or for, if you have a urinary tract infection, we're talking about a simple urinary tract infection, not something where you've got a fever associated with it, or as Andrea pointed out, you're immunosuppressed for some reason. Be careful to not think that you can just run to the store and get some cranberry juice and treat yourself, especially if you've got a fever.
Absolutely.
All right, this is a good segue, I think, to go ahead and bring in your slides, Andrea, and let you do
Okay.
your part.
All right. So I'm going to highlight some of the research here on cranberry tablets. So I do see a lot of patients with recurrent urinary tract infections, and I offer cranberry supplements as a tool in the toolbox, in addition to hydration, in addition to not holding your urine too long, among some other things to help prevent it. But it's certainly a tool in the toolbox. It is relatively well tolerated. I've had maybe 2 patients over the years come back and say, "I can't take the cranberry tablets because it makes me a little nauseous." Vic and Loria, have you heard that before? Patients saying that it makes them feel a little nauseous or queasy?
I have not.
Okay.
Yeah, I actually
Um,
have. I have.
okay. Yeah. So it
I think that we just
relative.
tell them. Oh, go ahead.
Go ahead, Lori.
Oh no, I think what people just try to do take it with food and water, when you're
Yeah.
taking it. So
Yeah, that's a good point. One other thing to know about, cranberry risks. If someone's on Coumadin, also known as warfarin, they need to get their INR levels checked. And those INR levels can change significantly with diet and medications. For example, if we prescribe an antibiotic that's not macrobid and they're on Coumadin, it could significantly alter their INR values. So they need to notify, or your office needs to notify their anticoagulation clinic so that they can monitor their INR more closely. If it gets too high, they could have serious life-threatening bleeding. If it gets too low, it could put them at risk of blood clots and other complications. Cranberry can alter INR levels when you're on Coumadin or warfarin. So I do have some patients who are on this Coumadin and want to do cranberry tablets. I just ask them, okay, we need to set up an appointment with your anticoagulation clinic so that they're aware of this. If you're taking cranberry every day, once they get that dose of Coumadin settled and the INR is stable, as long as you're taking the cranberry, then they can just stay on that. But if you come back off of the cranberry, it'll again make a change in those INR levels. So then they need to check it and find the new normal for the patient. But I certainly have patients who are on Coumadin who do use cranberry tablets.
Hmm.
And then here's my conversations that I have with patients in the clinic. There is some scientific evidence that cranberries can prevent urinary tract infections. It's mixed. However, there's enough science that the American Urological Association says that you can consider it, particularly in patients who have E. coli infections. What we think it does is makes the bladder wall slippery. That way, when the bacteria tries to hold on, it can't, and it just slips out. You just pee it out and it's not able to adhere to the bladder wall. That's why we get all those symptoms when you get a UTI. The bacteria adheres to the bladder wall and it causes inflammation. And then that causes the frequency, the urgency, the burning with urination. So I just quickly want to highlight some of the guidelines. I'm not going to go over all the guidelines because that's not the purpose of our conversation today. But as I was doing some research for this presentation, I thought, oh, let me remind the audience of these things because I think it's really important. Don't treat asymptomatic bacteriuria. Asymptomatic bacteriuria is just the medical term for you've got bacteria in your bladder, but it's not causing any problems. So we should leave it alone, unless you're pregnant or you're going to have surgery on your kidneys, your ureter, or your bladder. Those are some of the situations where you don't want to leave that bacteria alone. But we used to think urine was sterile. We've realized recently that it is not. And some of us, especially women, just live with a little bit of bacteria in the bladder. If it's not causing symptoms, we don't have to treat it, because if we keep throwing antibiotics and antibiotics and antibiotics at it, we're not practicing good antibiotic stewardship, and we will contribute to those super bugs that we were talking about. And there are scenarios, and I do see it, where we've run out of oral antibiotic options, meaning there's no pills left that are going to work for this UTI, and the only option is IV antibiotics, which is a big deal. It's uncomfortable to have an IV put in. It's either done outpatient or it has to be done inpatient. So we try to avoid that. You don't need to routinely do a cystoscopy on these patients. If you are suspicious that there's something that's contributing to these UTIs, then you can scope the patient. Some contributing issues could be a foreign object in the bladder. If someone's self-cathing, for example, if a little lint or a hair or a fuzzy gets a free ride into that bladder, the body will often form a stone around that little foreign object, whatever it is, and stones can harbor infections. If a stone is harboring the infection, you will usually see the same exact organism growing over and over and over and over again. So if you see that, you might want to look. And on a rare occasion, there is an old surgical stitch or clip from some other type of abdominal surgery that's migrated and moved over time and is now poking into the bladder. It may not hurt, it may not pinch the patient, but it is a great spot for bacteria to hold on. In fact, I remember one of my first cystoscopies I ever did, I found a little blue stitch clip from a previous surgery in the patient's bladder. Have you ever seen that before, Lori or Vic?
I have actually, with a little stone formed around the suture.
Yeah.
It's where they would sutured in the ureters on a transplant patient.
Yep. Yep, that can definitely happen. Or if they had a sling done in the past, sometimes that mesh erosion can come through into the bladder.
Yeah.
Or if they've got an artificial urinary sphincter, that can erode through and come through the urethra on male patients. So you don't have to do it for everyone, but if you're suspicious about one of those problems, you could certainly consider doing that. And you don't need to give antibiotics for more than 7 days. That's what the current guidelines say. I know in urology, I think a lot of us are in patterns of saying, 10 days, 14 days, a month. It's not really necessary to do longer than 7 days. I think that's important to use. Also, first line treatments are Bactrim, macrobid, and fosfomycin. Fosfomycin is also known as Monurol, and it's a one single dose. It's usually 3 grams. It's a powder form. In my region, we look at the antibiogram. Your infectious disease team, along with antibiotic stewardship team, will usually put together an antibiogram that shows the resistance rates of bacteria in your region. It does vary by region. In our region, we don't have a lot of resistance to fosfomycin, which is good, but the more we use it, the more resistance we're going to cause. In addition, fosfomycin really only works for E. coli or Enterococcus faecalis. So you can't use it for everything. And it's not always on the sensitivities for the urine cultures. So that's just one caveat. Something to think about. I know in the
That's an
past.
old school drug.
Oh,
Phosphomycin.
really?
That's old school. Yeah, it's been around a long time.
See, in my mind, for some reason, it feels like a new treatment.
Yeah, because it wasn't used very much.
Huh.
Let
Well,
me ask you a
I know
question
in the
while
past.
long as I interrupted.
Yeah.
So not more than 7 days antibiotics. I know there was a big push for doing really short, like 2-day, 3-day treatment options. Are you doing any of that in your practice?
That's only for uncomplicated urinary tract infections.
Mhm.
And in my practice, I don't see any uncomplicated urinary tract infection patients. All my patients are considered complicated. In fact, even after menopause is considered complicated. So I don't give those treatments, but it is appropriate for someone who's not a complicated patient.
Yep.
Yeah. I know in the past, years ago, Cipro was just given out for basically everything.
Like
Cipro,
candy.
Cipro, Cipro. Yeah. Now there's a lot of drug resistance to Cipro. It also has a black box warning for tendon rupture. So in the rare case that I do use Cipro, which sometimes that's all you're left with, I always warn the patient, hey, if you got, swelling or tenderness or pain in a joint, tendon, something like that, just stop your medicine and give us a call, or even go to the ER, because it can happen with tendon ruptures. And it's more likely if the patient's taking a steroid, or if they're older, or if somebody's super active. If they're on Cipro and they're like running a marathon, that could increase their risk of those problems. But the guidelines say you can offer cranberry prophylactic with women who have recurrent urinary tract infections. Again, it works best for E. coli. And the strength of evidence is a C level. We prefer an A level, but a C level indicates that it's probably worth a try. The risks are relatively low. So it is a tool in the toolbox that I offer to patients. So it's proanthocyanidins, PACs, or as Vic has named them, Pac-Mans.
Yeah.
They basically prevent the adhesion of bacteria to the bladder wall, as Vic highlighted. So now we're going to dive a little bit into the science. So I looked at the guidelines from the American Urological Association, which, by the way, you should all have access to. You should all have it on your phone. There is an AUA app that you can look at all the guidelines. They cover everything: BPH treatments, recurrent UTIs, microscopic hematuria. It's a really great tool to have in your practice, and I look at it very frequently. But they looked at 8 different trials, and there are some limitations to these trials. Sometimes they don't always say what the dosage was of the PACs. Some of these trials are not recent. Some of them are even from the 90s. But 5 trials did show that cranberry can decrease the risk of recurrence of infections. One study actually found a 20% reduction in UTIs, but they were using cranberry and lingonberry juice concentrate. Now, I know Vic highlighted some of the UTI prevention alternatives that are out there. I hadn't heard of lingonberry used. Vic and Lori, have you ever heard of that?
Nope.
Just like the chokeberry. I've
Yeah,
never heard of it.
Well, they do
interesting.
have
And there's
lingonberry pancakes at IHOP.
Wow, there you go.
Yeah. So if you want lingonberries, I know they have them.
Oh my gosh, that's cool. Yeah, and in fact, there's a research that was brought to my attention recently. Actually, rosemary, like a rosemary extract in a pill form, that might help. I
Mm.
didn't look up the research on that for today's presentation, but just interesting. One study actually found that patients who were using a cranberry supplement did use antibiotics less. Another study found that it decreased the number of patients who got a UTI. So they were giving the patients who got the cranberry juice, 20% of them got a UTI. Patients using a cranberry tablet, 18% of them got a UTI. And that's in comparison to a placebo, which was 32%. So that does show some improvement. Another study using the juice found that 29.1% had a relapse versus 49.2% in the placebo group. And one study found that the powder can actually help prevent UTI. So 10% of patients using the powder got a UTI, 25% in women who were on the placebo got a UTI. So there is some scientific evidence out there. I think it may work for the E. coli type of infections, and it's relatively low risk. Now, those guidelines were published in 2022. And then in 2023, there was a large-scale meta-analysis in the Cochrane database of systematic reviews, and they looked at 50 different clinical trials. They found that certain cranberry, as Vic was saying, he wasn't aware of the different types of blueberry. I also wasn't aware there's different types of cranberry, in fact. So there's a certain variety that is specific to UTIs, but they can prevent and reduce the risk of recurrent UTIs in women, children, and other at-risk individuals. So I just wanted to highlight a quick product discussion here. This is on a cranberry product known as Elura. I have no partnerships with them. I make no money with them. I have no stock with them. They don't even know who I am. But the way that I started using this is one of my colleagues had his mother was struggling with urinary tract infections. She started using this product and swore by it. So my colleague started recommending this product to his patients, and many of his patients also swear by it. So it's really just a recommendation from the patients that brought this to my attention. Now, there's a lot of different products out there. To my knowledge, no one's like studied them head to head to say this product is the absolute best one for the best price. And some of these products can be quite expensive. So that is one of the barriers that I find. But this one has 36 milligrams of the PACs or PACs. That's the active ingredient to help prevent UTIs. It is backed by 21 clinical studies. I don't have time today to go over all 21 clinical studies, but when we're looking at evidence and research, we like to see that research has been done within the last 5 years. So this is one that was actually done in 2024, and it was published in the Journal of Dietary Supplements. So their objective was to look at the anti-adhesion activity. They're calling it the AAA activity. That's how this medication prevents UTIs. And they were looking at cranberry versus D-mannose. D-mannose is another UTI prevention option. It is a naturally occurring sugar that is in berries. And there's actually some new evidence that came out, I believe, in JAMA saying that D-mannose might not work very well. Again, that's mixed evidence on the D-mannose as well. But they looked at 20 different healthy females and healthy males, people who were between the ages of 25 and 60 with no history of recurrent UTIs, actually, no urinary disorders, no diabetes, and no antibiotic use in the last 6 months. So they randomized that patient population into taking either 500 milligrams of D-mannose or the Elura dose. And then their urine samples were tested in the lab for that anti-adhesion activity. They found that the Elura cranberry dietary supplement exhibited 2 different types of the anti-adhesion activity, in vitro, which means in lab, and ex vivo, which means outside of the patient. So they just took these patients' urines, they brought them to the lab, and they tested it there. They did find that D-mannose had some AAA activity, but it was only type 1 adhesion. Cranberry also demonstrated a more robust and consistent AAA activity, then the D-mannose over their 1-week study and at different urine collection time points. So there certainly are some limitations to this study. One is that it was a very small patient population. It was only 20 people. It also was done in the lab. That's not perfect. That's not ideal. But when they're testing these anti-adhesion properties, that's, I think, one of the only ways that they found it was appropriate to treat. But it is a recent research study. So I don't know. What does everyone think?
I actually, there was a comment that their clinic recommended Allura, but it's very costly. And I actually ran into that last week when our providers tend to go with Allura as well. And there's this lady sitting and she's looking up and she's looking on Amazon. She's like, this is just way too expensive. So what do you do in that case, Andrew? What are there other recommendations?
Yeah, that's a good question. I have seen some other Urogyne providers recommending some Costco products. I'm not super familiar with them, but my understanding is that they're more affordable and they have the 36 milligrams of the PACs. When we're thinking about cost and benefit analysis, I do have some patients who say, you know what, the cost of X, Y, or Z cranberry tablet is less than my trips to the ER or my trips to the urgent care.
Yeah.
So that is something to consider for these patients, is what are the cost of your healthcare versus the cost of the supplement. But certainly that is one of the barriers with any type of supplement, is the cost, because they're generally not covered by insurance. Is anyone else familiar with this Costco brand? Maybe it's not Costco, or maybe it's just sold at Costco.
It's probably, yeah,
I
it's
don't.
Kirkland. Kirkland is their generic pharmaceuticals, and yeah, I
Okay.
mean, they're hard to
Well,
beat.
I'll be honest. I don't know
Yeah.
if it's Kirkland. I don't know what brand it is. I just understand that there is some sort of cranberry tablet at Costco that has a very comparable number of PACs.
All right. There was a comment
Mm.
I saw that came through. I want to make sure we don't miss this from Tabo, that immunosuppressed therapy are encouraged to avoid cranberries. It alters the medication. So I know that's my father was on anti-rejection drugs, and he had to watch certain things because foods that would not agree with it or would counteract it. I didn't know about cranberries. I knew it was grapefruit for my dad.
Yeah. Thanks, Tabo. That's a good point.
I got a question that kind of prompts me to ask another question about what about patients who are in BCG? Would you, because I mean, will that prevent adherence as far as the BCG
Hmm.
is concerned? Will it affect BCG at all? Anybody
Great
know?
question. I do not know.
And never saw any research on that. I know the big thing with BCG is they tell you not to give patients antibiotics because you're killing a bacteria, and that's
Right.
what they want, is the bacteria. So even some of the as far as like even some of the preservatives that are found in the lidocaine, if you're doing that ahead of time, they're saying could even deactivate it. I don't think I really buy that, but I've read that. So
Hmm.
all right. Any further questions in the audience? Is that your last slide, Andrea? Is that your last slide,
Yeah,
Andrea?
I just wanted to
Okay.
highlight here that I just have my
Oh,
references there. Yeah. Yeah.
oh, wait a second. We'll bring those up here real quick.
Yeah. So here's the references.
And
So, you know, my conclusion is it's listed as an option in the American Urological Association. You just have to be, thoughtful about who you're selecting this treatment for. As Tabo
yeah,
mentioned, I guess it can affect immunosuppressants and things. So you want to make sure you're using it in the right patient population. And again, it works best for E. coli. Some people want to try it even if they're not having E. coli infections. I tell them, worst case scenario, it's not doing anything and it's not helping, but it's relatively low risk in most patients, so you can give it a try.
So my understanding is the Allura or the pills just have a much higher concentration of Pac-Man than drinking cranberry. You have to drink a lot more cranberry juice to get the same effect. Is that right? Is that what you would say, Andrea?
Yeah.
Okay.
Yeah, it has high levels of the active ingredient. And I have heard in the past, when we're talking about cranberry juice, there's some that are just all sugar, and there are some that are very concentrated. I remember working with a nurse practitioner who always recommended that her patients go to the health food store and get the very tart, very concentrated, expensive cranberry juice and then mix it with some water to make it more palatable. Have you seen that?
Mm. I have no. I know that's one of the big things that they mentioned in that study that I was going over was to watch the high sugar contents, because a lot of these are mixed with sugar to make them taste better. Of course, it's easier to sell something that tastes better but not necessarily as good for you. One of the things I did want to ask you about, and it's just kind of a personal note, was you mentioned that this is for treating, we don't treat asymptomatic bacteriuria. Then had a family member recently, a consult where she came to me and said, "Hey, I just saw this new doctor, and they ran a bunch of tests, and they called me up and said I need to get on antibiotics because I have a urinary tract infection." I said, "Really?" So I said, "Do you have any symptoms?" "No, I have no symptoms whatsoever." She says, "I think there was another person's urine that was in the same collecting chamber." And she says, "Maybe they got them mixed up." Well, who knows, right? But this person said, "Well, you don't have to treat it, but if you get septic, and I'm like, now this is bizarre, because nobody would treat asymptomatic bacteriuria. So I said, "Well, give me a urine sample." I was going to the office, so I said, "I'll check it in my office." There wasn't any bacteria in the urine. There was negative on the dipstick. I don't know. Maybe they did get them confused, but I think the point is, we don't treat asymptomatic bacteriuria unless there's another reason, like you had mentioned, they're having surgeries of some sort, or they have their immunosuppressed. So keep that in your mind when you're looking at these things.
Yeah, absolutely. And, sometimes patients will say, "Well, no, I don't have any symptoms of urinary tract infection, but I'm here today because I've got overactive bladder." And
Mhm.
sometimes I'll test their urine and find that they've actually had like a low level UTI for probably a long time. If I treat that UTI and their frequency and urgency, which what they thought was an overactive bladder, if it gets better, then it was an overactive bladder. It was actually a UTI. I've had a few
Yep.
patients like that come in who just said, "Oh, I'm here for overactive bladder. We treated the UTI. Now it's all gone." So just keep in mind, it doesn't always present with dysuria and abdominal pain and those classic symptoms, especially as we age. The symptoms can change. It could turn into just
Mhm.
confusion or what feels like OAB. So always
Yep.
rule out a UTI if you're thinking they've got OAB.
Good point.
I think one of the things that we didn't mention yet either is postcoital UTI.
Mm-hmm.
As far as, I think this is great, especially with the younger population in Cranberry, and something simple that could prevent also urinating, prior to intercourse and after, to flush out any bacteria, because the whole point is that obviously there's E. coli in our colons and so forth, and that bacteria is so close that during the process of intercourse, that bacteria can be milked up into the bladder. And so it's
Yep.
important to pee before and after. And I think cranberry is a good, simple way to try to prevent that for those postcoital UTIs.
Yeah.
All right. So here's the big question. Is it myth or is it medicine? Andrea, what do you think?
I'm still sticking with medicine because I follow evidence-based practice, and it is listed in the guidelines as a potential option for UTI treatment.
Lori, what do you think?
I say medicine as well. Just we have a large portion of patients that come in for recurrent UTIs, and the fact that the majority of them are saying it does help, that alone to me, why not keep prescribing it, I guess you could say.
Yeah. And those that are watching live, if you want to put your thoughts, myth or medicine, go ahead and put those in. I'm going to go ahead. I'm going to go with you guys. I think that there's enough research out there to prove that this is really a good treatment, a medical treatment that we can have as one of our tools. Again, don't eliminate the, looking at the whole patient and all the other options that are available. But I'm going to go ahead with medicine. I see some comments coming in. What are we getting?
I think April said it right. Medicine for the right patient.
Exactly.
And both Rajesh and Neil both said medicine.
All right. Well, great. This has been fun. This is something different that we haven't really done, where we've had this kind of discussion throughout the whole process. I hope to do more of these. For matter of fact, I hope you guys will join me next week, because I do have a thought for next week's program, kind of a similar format. I'm going to put a promo for that right now.
This week, our UroNurse experts discuss the results of the office cystoscopy survey, as several key insights emerged. The survey highlighted variations in practices, such as differences in the use of local anesthesia, sterile versus clean techniques, and post-procedure reprocessing. Can equipment standardization and streamlined workflows enhance efficiency without compromising care quality? Join UroNurse.com next Saturday to learn more.
All right. So I've already rooked you guys in by putting you that you're going to be here. So next week, we're going to discuss, give a little background to what the cystoscopy survey is. If you guys have not seen it or completed it, I would like if you would. But I created a survey, a very simple, probably 2-3 minute survey. You can go to UroNurse.com. Shortly after the show, I have to put it up. I haven't placed it up there. There will be a little button that you can click to get it. I did include it in the mailer that went out through MailChimp. So if you're on that subscribing list, you probably got that. I will put it out one more time, because the more data you get, the better the data you get. But in September, I'm going to be speaking at the SUNA meeting in Orlando. I'm going to be talking about 2 different things for SUNA. One is going to be on why I think this is going to replace the regular meetings, the in-person meetings in the future, the virtual versus in-person. So you know where I'm leaning, but anyway, it'll be interesting to come and hear my talk on that. And the other one is going to be a preparation on how do you set up for cystoscopy, how do you set up for vasectomy. So I think this one is aimed at the new to practice people. So I'm going to give that talk. So as I'm putting my slides together, because they're due pretty soon and I'm a procrastinator, I got the idea that I'll bet there's a difference between how I practice and how Andrea practices and how Lori's office practices, and probably how everybody's office is practicing. There's a lot of things we're doing the same, but there's a lot of things that are being done differently. And over the course of time, things have changed. So I got a really simple survey together. It's not going to be something that I can say this is really reliable data, but I think it's some interesting talking points, because I have done a lot of research into how things should be done for these procedures, and have been actually part of the SUNA white paper on cystoscopy. So I do have some background in this area, but I really thought this would be helpful. So I'm going to ask you guys to help me out by completing that survey. Again, if you didn't get the email, you can go to the website as soon as I'm off this show. I'm going to make that live, complete that for me. And next week we'll discuss it. So Lori and Andrea, hope you can join me, and maybe we'll get John to come and join too, and get he's always got a good opinion on things, but that should be fun. The other thing I want to put out is a promo. If you guys are interested in learning more about what we're doing, this virtual business, how we put this on, I'm going to start a thing called Boot Camp. Rally for Boot Camp, our monthly meeting where we decode the art of video streaming. Enlist for tactical sessions on cutting-edge techniques, intel on industry shifts, and a chance to appear live on my streaming program. Gear up, Stay sharp and gain the upper hand in the streaming battlefield. No experience necessary. All are welcome. There's a limit of only 10 live participants, the first 10 to register, and 200 spots additional available for watching. Questions can be submitted via the comment box. This event will not be streamed on any social media platforms, so no worries about appearing live online. And it all starts September the 4th at 7 p.m. Central Time. Be there to join us on boot camp. So open invitation. Anybody can join. You don't have to be in healthcare. You just have to be interested in learning more about how to present, some presentation skills. It's going to be a once a month. Right now, I'm planning a once a month discussion. Starts at 7 p.m. Ends whenever I get everybody to be completely satisfied that we're done. So we'll see how long it goes. But we'll be talking about different subjects. I think they're going to kick it off with talking about the importance of sound, how to get the best out of your system, what you need as far as equipment goes. You know, some of these studios are multi-dollar studios, and others are not so expensive, and they all can work. So we'll be discussing all those things at boot camp. So be sure to join me. All right. Do we have any other last minute comments that came in, Lori?
We do. We have from Tabo, thanks for the presentation, Andrea and team. Great information.
You're welcome.
And Tabo says, I'm excited about next week's topic, which I am actually too.
Yeah.
And then Fran, see you at SUNA.
Yeah. Hopefully a lot of you will come to, it's Orlando. I mean, it's going to be a SeaWorld, which is kind of different. So fun place to go. I'll be there the whole time. I'm going to try to make arrangements to shoot filming and of UroNurse stuff going on at SUNA, and we'll try to get together and maybe broadcast that day live somewhere. Definitely will be a broadcast, guarantee that. But like to see as many people out there that know about UroNurse to stop and say hi. So with that, we'll call it a day and see everybody next week on UroNurse.